Started your timer and finish your question. Right, so if you have read and understood, considering that history taking session, kindly begin.
Hello, I'm Dr. Muhammad, an exam surgical candidate. Today I have been asked to ask you some questions related to your condition. Are you okay with that?
Yes, doctor.
Thank you. May I confirm your name and age, please?
Yes, my name is Nada. I'm 53 years old.
Nice to meet you. Before we start, do you want me to switch off the light or give you some analgesic?
No, doctor, I think I'm fine.
Okay. So what's brought you here today?
Doctor, I'm having severe headache. I don't know. It just started suddenly, but it's very painful for me.
I'm really so sorry to hear that. When did you first notice that?
I think I had the same kind of episode a couple of months ago, but this time it was a sudden episode.
Okay. Can you point to the site of the pain, please?
Yes, it's basically it is overall. It's almost everywhere, but it's more of the on my sides
Okay. Does
of
it
the temple.
okay? Does it go to anywhere else?
No, doctor, no, it does not.
Okay. Does it start suddenly or gradually?
It was a sudden onset headache. So yeah, it wasn't gradual, just sudden.
Okay. Does anything make the pain increase or stop?
I have taken analgesic, but that does not seem to help. And no, I didn't notice if anything caused the pain particularly.
Okay. Does it go and come? Does it change recently?
Doctor, is just there. This headache is just there. It didn't disappear.
Okay. Sorry for that. If you had to rate the pain from 1 to 10, 10 is the most worst imaginable, how would you rate it?
I think I'll rate it 9 because this is very intense, very severe, and this is one of the worst headache I ever had in my life.
I'm sorry for that. Do you want me to give you some analgesic?
I think I feel I'm a strong lady. I'll be able to handle that. Yeah.
Okay. Does it affect your day-to-day life?
Now it is, yes. I'm not able to concentrate. I'm a teacher. I was not able to go to school today because of the same reason.
I'm really so sorry for that. Does it change throughout the day? Does it increase during a specific time of the day?
No specific time for it.
Okay. Do you have any throughout? Did you throw out or you have vomit?
I was nauseated, yes. Didn't throw up, no.
Okay. Did you lose your consciousness?
I did, yes. So basically this is exactly what happened, what was told by my husband. I was preparing to go to school and I suddenly passed out. I do not know what happened. and ever since whenever when I woke, this is when it started, and it's just
Okay.
there since then.
For how long did you lose your consciousness?
I don't know, for a couple of minutes, or maybe like say 1 minute or so.
Okay. Do you have any weakness in your arm or legs?
No, doctor, I did not notice any weakness.
Okay. Do you have any visual disturbance or any kind of sensory
No,
loss?
not no, but I did think that maybe like when I woke, I was having difficulty in focusing on the far object.
Okay. Did you lose your weight recently, or you have change in your appetite?
Lost weight, I didn't notice. My appetite is, yes, a little less.
Okay. Do you have been feverish or been ill recently?
No, doctor.
Okay. Do you have any rash in your body or any skin change?
No, doctor. No rashes.
Okay.
No.
Okay. Did you hit your head or fall down?
Like recently, are you talking about the episode when it happened? No, doctor.
Okay. Do you have like neck stiffness?
No.
Okay. Do you have any other chronic conditions?
Can you present your history
Yes,
now?
I'm.
Okay. Before I present my case,
Yes,
if time would allow me, I would like to ask about past medical history
yes.
and also ICE, idea, concern, and expectations, and also about family history.
Yes, drug history,
Yes,
social history.
and also
Yes,
systemic review.
Yes, okay. So can you present your history now?
53 years old female,
Yes.
had a headache and mainly in the temporal lobes.
Yes.
He had similar episode like 1 month ago,
Yes.
and there was loss of consciousness about few minutes.
Okay.
No family history.
All right. When she
And
lost her consciousness, did she hit the floor, the ground?
no history of
Any history of trauma?
trauma.
Okay.
No.
No history of fever?
No history of fever and no history of signs or
But
symptoms
then
of
she
increasing
was
intracranial
sensitive.
pressure.
Okay. She was sensitive to light.
Yes.
What were your differential diagnosis for her?
Could be due to meningitis or could be due to any brain tumors or encephalitis.
Okay. How would you confirm your diagnosis?
Firstly, I will order some investigation, routine investigation, CBC, urinary doctorate. Then would like to ask for CT scan and also do CSF tabbing.
Okay.
And
What treatment alternatives can you offer to this patient?
first, I would like to manage using ABCD approach, ensuring that the patient is stable, and then refer it to the neurosurgical department. And also, I would like to discuss in MDT after the investigations. Patient might need bed rest and fluid, and also some calcium channel blocker. Then I will manage accordingly.
Okay, good. Thank you. Right. Why did you not think of subarachnoid hemorrhage? In the exam scenario, subarachnoid hemorrhage is the only scenario which will come. And patient, yes, you want to say something?
there's no history of trauma, and also I didn't get the time
do
to
you
ask
need-
a family history. It could be due to aneurysm.
for subarachnoid hemorrhage, does it need to be trauma?
Okay.
Always? And there was no history of fever as well, but patient was sensitive to light. So something has happened. So that was one of the differential diagnoses. And in fact, that is the provisional diagnosis that you have to rule out. But then you have to rule out other causes as well, of meningitis, of all other causes that you are, brain tumor, all other causes that you were trying to rule out. So one question, one request, like when you were asking and you asked the patient if you had any fall, and she told you, at that time you could have asked, did you, at that time you could have asked and rule out the trauma part, that when you fell, did your head banged against the ground? So that you would have known. And when she was telling that she's sensitive to light, then you can ask about the fever and the rashes and everything at the same time. So like if you ask in this way, then it would not be a repetition that you are asking afterwards. You are asking all these associated or related questions together. And yeah, the last question that you were asking, if you have any chronic condition, then you can ask if there is any condition for which you're seeing your GP regularly instead of chronic, because they may not understand the term chronic.
Okay.
Yeah, thank you. The rest was good. Dr. Nida, you want to add anything? Any feedback?
No, ma'am, but it was a good history.
Yeah.
Again, it's just that when we start asking, we tend to miss some points. This is what I was. You said it right, that when I said it was one of the worst headaches that you have, so I think the differential should include subarachnoid as well. Rest is good, I think.
Rest is good, but this is the number one in exam. They'll have this. In critical care, it is extradural head injury, but in history taking, it's subarachnoid. It's the character. You didn't ask about the character of the pain. Is it throbbing pain? What type of pain is that? You did say where is it, but didn't ask about the character of the headache.
Okay.
Yeah. Good. Thank you.
Thank you.